Welcome to the Canadian Dental Equivalency Navigator session. I'm Amir. I'm hosting this event today. I'm so excited to have this session all together in the Monday, sunny day out there in Toronto. And I wish this session gonna be wonderful and addressing all your concerns and questions about dental equivalency process. So let's jump into the slides and I'm gonna tell you the agenda of the session. But before that, I just wanted to take the control of slides. If the Zoom can give me, oh yeah. Okay, today we're gonna talk about exams, courses. We have two guest speakers coming from CIBC and Buildmill to talk more about the financial stuff and financial aspects of the dental journey that you're gonna have during the coming years. And at the end, we're gonna talk about the ConfiCare campaign that we are just run it, and it's lots of good stuff talking about like how we support our community and our members to have a smooth journey during their dental equivalency process, and also passing the exam and get the certificate at the end. Let me talk a little about ConfiDentist. So we at ConfiDentist, over the last 10 years, we've done the preparation courses through the classes and sessions and workshops that we plan to make it strategically smoother for our members and clients to get their desired result. And so we had lots of great session over the last 10 years, and hundreds of dentists out in Canada were having this journey with us through this years, and we are proud to have a great result, and we are happy to have this strong community and productive community that from the starting date and to the end and after graduation, they have a successful career in the country. One of my great colleagues of mine, Dr. Dela, today will speak and talk more about the courses and exams, and we're going to get into this insights of the process. But let me introduce Dr. Dela. She is DDS and at 2018. She's done the AFK course and ACJ course at 2020 with ConfiDentist. And now since 2021, she's doing the mentoring for our students and for our clients. She is fitness enthusiast and blogger, and a lot more. She's gonna talk about it, and you will see in the coming session. And also we have Sachin from Wildmill and Simon from CIBC to go over the financial stuff. But help me to introduce and help me to invite Dr. Dela to the session to officially start talking about exams and let us know more about what is this process and how we can have the better process. Round of applause for Dr. Dela. Dela, I'm passing the session to you, and good luck.
Thank you, Amir. Good morning, everyone. Thank you for taking a time to be here with us today. My name is Dela. As Amir said, I am an international dentist myself. I'm from Iran. On behalf of ConfiDentist team, I would like to welcome you all to our Canadian Dental Equivalency Navigator webinar. We are very happy and proud to be here today with all of you. I'm going to start with a little bit of introduction about myself. So I have been with the ConfiDentist family for almost 5 years now. I started off as a student in 2018, passed my AFK and ACJ 2020. To be honest, even then when I was a student, I always would dream about like being a part of this team during the classes all the time. And then in 2021, it actually happened, and I started my role as consultant and mentor at the same time as they were launching the pre-recorded courses for the first time. Over the past 2-3 years that I've been here working, I have worked with over 300, I would say, at least foreign dentists I've had the honor of assisting them prior to their application process, addressing any question that they might have had with like the application, how the process works, the general idea, how to prepare decision-making and stuff like that. And mostly as the mentor during their AFK preparation. Some of them are now licensed. You'd be surprised to know. Some of them are in school. Some of them are taking the rest of their exams. Everyone's moving on, for that matter. Among my own immigration process, equivalency, the job, and everything, I managed to become like the other things that goes on in life, because you're going to have to move on with your life at the same time too. I managed to become a gym rat. It has taught me discipline, that's given me a healthy and strong body, whatever. Very much recommended. Today, I have the pleasure of being here, share my experience with you guys. I'm very happy about that. Honestly, I cannot begin to describe how happy that makes me. I hope that by the end of the session, all of your questions about the equivalency process, preparation, finances, balance with life, and everything will be addressed. So, as you already know, in this webinar, we're going to talk about the process, which is technically the exams, how they work, how the exams work, what the pathways are, what choices you can have. I'm also going to talk about the courses and what we're offering and what course could be helping you better throughout your process. We're going to speak about the job opportunities that you can have throughout this journey, during your journey, while you're taking your exams. And as well as the options that you can have in terms of managing the financial aspects of this, because we all know that it is not going to be a very non-expensive journey. So here's just an overview. It's a glance over the exams and everything. So what you need to take very seriously, all of you, is that each of these steps have their own rules, okay? And it's very important to be very well prepared for every single step, okay? So the whole idea, the general idea, this is something that you can see ahead of you, is after you're making your profile, obviously you're gonna have to apply, then you're gonna have to go through some exams, and then you're gonna have to go through some preparation courses if you decide to go to school and everything. I will talk about all of these in detail. But in general, you will have the profile, AFK, ACJ, NDEC, and OSCE. So again, I'm going to repeat myself. So it's very important to know the rules of the game in each of these steps. That is the fastest way. That will be very most cost beneficial, time efficient, and everything, to just know the rules of the game. And the way to know those rules are courses. Okay. So for each of these steps, for every single of these steps, we are offering courses for you, okay? AFK, ADAT, even if you want to go to university, if you want to go through the other pathways that I will talk about, everything, okay? All of you guys are very knowledgeable, are very experienced, all of us are, so we're dentists at the end of the day. But again, it's important to know what to do for this specific game, you know? So while we're doing this, any internationally trained dentist, when they're going through this journey, well, you cannot stop living. So you have your life as well, and you're gonna have to create some kind of balance between these these exams, the process and everything, and your actual life. All right. So there are some job opportunities that you can have throughout, during, which again, I am going to talk about. I don't know why this is doing this to me. So what you can do is you can go and work in non-dental jobs. You can go and become a dental assistant. You can do some other stuff in dentistry, like you can go and just seek the hygienist kind of career. Again, I'm going to talk about them. And then is the financial aspect. So again, I'm pretty sure that you all have researched. If you're not in the process yet, still you have all gone through the research and you know that you have an idea about how much it's going to cost you. So you're going to need to be able to pay for all this, right? So you're going to have to know the costs, how much it's going to cost you averagely, and how you're going to manage to pay for them. You might have your savings, you might be working, your income at the same time. You can get some financial aid along the way. We have Windmill, we have CIBC, we have Windmill CIBC, we have the plans, which are the exciting part. And for Windmill and CIBC, as Amir said, we're going to have some guest speakers directly from those institutions, those organizations. They will go through the details with you guys. So this is the general idea of what we're going to talk about throughout this session. I'm going to start with the exams. So let's begin. So everything starts with an application. So you're going to have to apply for the whole thing before you do anything, okay? So the first thing is NDEB profile creation. I'm sorry, I don't know why it's not working. Okay. So you're going to have to apply for NDEB. You do that through the NDEB's website before doing anything else. So you go through the, they have a portal which is called NDEB Connect. You will create your profile there, submit your profile, and you're going to have to pay for it in 4-hour time manner. The important thing to consider is that you have to have a very good information about what kind of documents you're going to have to send to them and they need from you. You have to be very accurate. So make sure that you go through the they have a guide themselves. Make sure that you go through it very detailed and read every single word in that. If you need any help, you can always book a session with myself here and I will walk you through it word by word. But please just have this in mind and take this from me, that the smallest, tiniest mistake in this application and this documents that you need to send them can delay your process by like 6 months or even more. All right. So please make sure that you go through everything accurately, exactly the way that they want you to. All right. So you create your profile. So it's the creation of the profile is online, but everything you will send them is going to be paper-based. All right. So you're going to have to mail everything. All right. While you're doing this preparation of the documents and waiting for their approval, all right, when you're doing that, so you create your online profile, you gather your documents, you send the documents to NDEB. The important thing is not wasting time when you're waiting for their approval, because it usually takes around 4 to 5 months for most people to get their approval from the NDEB. All right. It's very, very important to not lose time. Sorry, I'm all about gym and losing weight and working out. So it's very important to not lose time during this process when you're waiting. Okay. So that is the best time to start preparation. Okay. So what we're going to prepare for. The first step after you get your approval, so you already have your application, you already applied, you already sent your documents, you're going to have to go through the first step, which is what? AFK exam. All right. And I talked about this preparation over here. So when you're waiting for the approval, you should be already started. You should have already started your preparation. Okay. So AFK, let's talk a little bit about AFK. AFK exam is the first step that you have to go through. It's the first challenge, if I want to be accurate. It is an exam, 200 questions, multiple choice, single answer from everything in dentistry, everything that you might have gone through in your dental school when you were back at school, okay? Everything in dentistry, 200 questions. And these questions are usually very detailed and very long and very difficult in the matter of like your grammar and everything. So it's very important to be very well prepared. You can take AFK exam for a maximum of 3 times, right? You can take AFK exam for a maximum of 3 times. And it is conducted twice a year, once in February, once in August. First week of February, second week of August, usually. All right. The passing score is 75, but they will not give you a numeric score if you pass. So if you fail, you will know your result. If you don't, if you pass, you will not know what your score was. They will just give you a pass or fail report for that matter. Okay. So AFK, again, it's the first step. It should not be underestimated. It's the most important step in my opinion, because when you pass it will give you a motivation rush afterwards, because then you will see that it's actually possible. Then you will be like, it will give you a lot of more confidence, and it will just give you that boost you need to keep going. All right, so take AFK very, very seriously, and take the preparation very seriously again. Okay, so that is the first step. You take AFK, hopefully you will pass at your first attempt. If not, that's okay, you can take it again. After AFK, what happens after? Oh, and one thing I forgot to mention is that anyone on any visa can take AFK. So you don't need to have any specific visa, they don't even ask for it. So like even if you're a citizen, they don't care. If you're on whatever, like work permit, study permit, whatever, they don't care. You can take AFK on any visa that you might be on. All right. So that's your first step. Okay. After AFK, what happens? You have several options. Depending, this actually matters what your visa status is when you come to this. When you get, let me have my laser. When you get here after your AFK, your visa status will become a little bit important. Could be, I mean. So after that, you have 2 options. You can choose to go through the university pathway if you are a permanent resident or a citizen of Canada. Or if not, if you don't have that option, or if you just don't want to, you can go through the direct licensing pathway. All right. So after AFK, you have 2 options: university for permanent resident and citizens, direct licensing, which includes 2 more exams for everyone. Okay, any kind of visa that you are on. All right. So let's talk about all of these. So to get into university, first of all, you have to know that we have 7 dental schools in Canada that are offering the advanced standing or degree qualification program, which is specifically for internationally trained dentists. 5 out of the 7 schools are asking for an exam, like the requirement is ADAT. It used to be AFK before, until like a couple years ago, but now these days they are asking for ADAT. It's an American test, which it's short for Advanced Dental Admission Test. All right. So after AFK, you can go through ADAT. Why I say after? So just, I don't want to confuse you guys. So AFK is not a prerequisite for ADAT, but it will help you it will help you prepare better for ADAT if you've already taken AFK, because they have a lot of, like, when you prepare for AFK, technically you're preparing for like 40-50% of ADAT as well. All right. So you take AFK, you're already program that you're already prepared for like half of ADAT, then you can, after that, you can just go through the rest like for a couple months and then take your ADAT as well. And you can apply to those 5 schools, which are University of Saskatchewan, University of McGill, University of Toronto, University of Manitoba, and University of Alberta. Okay. So I said 7 schools, 5 of them are asking for ADAT. 2 of them are still asking for AFK. So they are not yet asking for ADAT, but I believe that they will soon. So those 2 schools are University of Western Ontario and University of Dalhousie. All right. So what PLA is here, we have PLA here, and we have bench test. Okay. So after you take AFK, you can take your ADAT for those 5 schools, and you can directly apply for those 2 schools, which are Western Ontario and Dalhousie. All right. So each of them has their own rules and specific pathway. All right. I will talk about that, but after I'll go through the direct licensing pathway, if that's okay. All right. So that would be the general idea for citizens and permanent residents who want to go back to school. I will go back to it after at the end of the slide. So for every other people, like everyone out there, they have the direct licensing pathway, right? Direct licensing pathway, after AFK, you have the second exam, which is ACJ, okay? ACJ, Assessment of Clinical Judgment, all right? Sorry, I forgot to mention what AFK stands for. AFK stands for Assessment of Fundamental Knowledge, right? So we have AFK, you pass AFK, then you want to go through direct licensing, then you will go through ACJ, which is the second exam. ACJ is also conducted twice a year, once in May and once in November. It is also a written exam, and it is a whole different exam, but it's written. It's a whole different exam. I will talk about how it works. And you can take ACJ maximum of 3 times as well, and passing score again is 75. ACJ is also a written exam, as I said, so you will have around 120 to 150 questions. They are multiple choice, but they are not single answered necessarily. So it's not like in AFK, they will give you like 4 or 5 options for each question, and you have to choose one, and then you will move on. But ACJ is different. They will give you a case. They will give you a patient's chart. And based on that chart, they will ask you questions. This question might be about X-ray, which is like 60% of the ACJ exam. This question might be about what happens if a specific patient, which you have the chart for, collapses in your dental office while you're doing something, how to manage them. It could be about like specific treatments, what to do, what the treatment could be. All right. So these are the questions that they can ask, but how you should answer is that they would ask you for 1 or more correct options. All right. They will ask you about 1 or more correct options. So that is what makes ACJ tricky, because among these correct options, let's say that you have a question, it has like 10, 12 options, and you have to choose more than 1. All right. And you don't know how many correct questions, correct options are there. So you might get negative markings here, because if you choose, like, let's say if the question has 4 correct options and you choose all 4 correct options, and then you choose 1 incorrect one, that could clear all of those your correct answers for that specific question. So that is what makes ACJ a little bit tricky. All right. But still, if you know the rules, if you know how to prepare for it, if you know the technique, it's kind of technique sensitive kind of exam, you will be able to crack it. You just need to know how to prepare. All right. So that's ACJ. Again, you pass AFK, you pass ACJ, you will go through the 3rd exam, which is NDEC. I will talk about this university pathway in detail soon. You will pass, you will go through NDEC exam, which is the 3rd exam. All right. NDEC exam is technically 2 exams, which is compressed into one. All right. National Dental Examination of Clinical Competence. It has 2 parts: skills and situational judgment. All right. It's conducted in 2 days: skills and situational judgment. In the skills exam, you will have to do actual dentistry jobs. All right, actual dental projects. They will give you 7 projects. You will have to do those projects in like 8 hours. And it's technically 8 projects, but I will tell you what those projects are. So you will do it on a Darwin's head. All right, it's on a mannequin and on plastic teeth. They will give you everything that you need. So every equipment, every material that you need, it will be given to you when you're taking the exam, obviously. All right. So the projects are prompt preparation, which I believe is usually PFM, but they might give you like full term and other stuff. Provisional crown fabrication on the preparation that you already done yourself. Crown preparation, provisional crown fabrication, MOD amalgam preparation, MOD amalgam restoration, MOD composite restoration, class 4 composite restoration, and an endodontic access only. All right. There's a criteria on the NDEB's website which tells you what they expect from you. And it's technically a perfect artwork. Is it achievable? Definitely. You practice for it correctly, and you'll be fine in a good time. All right. So that is the first part. And during those days, during that date that you're doing these projects, you have to be aware of your infection control. All right. So that would be your 8th project. So that is the first day or second day. One of the days are the NDEC exam, which is the clinical skills part. The other one is situational judgment, which is a different kind of exam. It's a verbal exam for the most part. So you will have some stations. In each station, they will ask you a couple questions. This question could be written or could be verbal, which is a kind of a role play kind of thing. So in this written, the written questions could be, they might be asking you for prescription writing. They might ask you for, it's not going to be multiple choice anymore. It's going to be written. You're going to have to actually write things. They might ask you to write like a specific kind of prescription. They might ask you to write a referral. I don't know, a lab referral, whatever. Something that, things like this, the things that you come across in your clinic, in your practice. That's one thing. Or it could be verbal, which is technically the most important to me, in my opinion, is the most important part of this exam, which it will be a role play kind of situation. You will be the dentist in the clinic, and your examiner come in as an actor, and they could be acting as your patient. They could be acting as your assistant. They could be acting as your hygienist. They could be acting as like a sales representative. Any of these situations, and you should be able to handle the situation. All right. So it could be your patient coming for like asking for a treatment plan for their problem. They would give you a chief complaint, and you have to be able to explain to them the treatment plan in a way that they understand. Okay. So this is how it works. So that would be the situational judgment. All right. And this exam, this whole NDEC exam, we call it NDEC or NDCC, should be passed in a duration of 5 years. So you will have 5 years to pass this, beginning on the day that you get your passing result for ACJ. All right. So I'm gonna do a flashback here. You passed your AFK. You take your ACJ. Today, your ACJ score is out, and you're passed. You know that you've passed. You have 5 years to pass NDEC. All right. And in this 5 years, you can take it as many times as you want, and you can, because like registration is another option, another thing. I mean, so let's say that you do take the NDEC and you pass like the clinical skills part, and you don't pass the situational judgment part. You will have to repeat the situational judgment part only. So the part that you have passed is done. All right. The reason that it's tricky is, well, it's a little bit subjective, a little bit more than a little bit. It's subjective. So, and it might be like to different eyes, it could be different. The result could be different. And the other thing is that, as I said, like they ask for like a perfect artwork for you, which you can definitely master when you practice right and correctly for the appropriate amount of time. But for this clinical skills part, you will have to pass all of the projects. So they will give you they will give you some scores for each project, and you have to pass all of these projects. And to pass each of these projects, you should be at least minimally competent. All right. If you get a score of not competent for even one, you will fail the whole thing. All right. So that's why it's tricky. The same goes for the clinical, the situational judgment thing. All right. So this is the whole idea about the direct licensing equivalency. All right. That is the direct licensing equivalency. AFK, ACJ, and NDEC. You take that, you will be recognized as someone who is equivalent to someone that has been freshly graduated from a dental school in Canada. You're not gonna have a DDS degree. They're not gonna hand you a DDS degree, but you will be allowed to sit for the OSCE exam, which is the last exam. All right, which is the final exam which everyone should take. All right, I will talk about that as well. So, guys, before I go back to the university pathway, do you guys have any questions about the direct licensing? I think that it's better if we do that first. If you have any questions, now would be a good time. Think. Okay, so the admin is asking me to answer the questions in the end. So, all right. Okay. So let's continue. And in the end, if you have any questions, I will answer them. All right, so I'm gonna go briefly back to what I said. So we have the direct licensing, we have the university pathway. Direct licensing is for everyone. University pathway is only for citizens and permanent residents. All right, so you take direct licensing, AFK, ACJ, NDEC. All right, you pass it. Let's say that you don't pass NDEC in that 5 years. All right, let's say that, like, this is something I forgot to mention. Let's say that you don't pass NDEC in that 5 years. Your 5 years is finished and your NDEC is not passed yet. You can restart the whole process from the beginning. All right, only one time. All right, so your 5 years has passed. You haven't passed NDEC. You can restart the whole process. So you can take AFK again, take ACJ again, and go back to the NDEC. The whole process can be restarted again once. That's it. So that's it for the direct licensing. Then I'm going to go back to the university pathway. So I said for university pathway, we have AFK, we have ADAT. AFK is for 2 schools. ADAT is for 5 schools for now. So you take that. Let's talk about the 5 schools that are asking for ADAT first, which I'm going to repeat myself: University of Dalhousie, University of Toronto, University of McGill, Alberta, Manitoba, and Saskatchewan. After that, you're going to have a bench test. So let's say that you take your ADAT, they're going to ask you for some kind of English proficiency score, IELTS, TOEFL, whatever. They have their own specific requirements. It's different for each school. I ask you guys to just go and check the website. It's different. It's usually around 6 to 7. Except for University of Manitoba, which are asking for 7.5, if I'm not mistaken, IELTS. So you take your ADAT, you take your AFK, you take your ADAT, and then they will invite you for a bench test, right? Some of them have their bench test before, some of them have their bench test and interview at the same time. So the bench test could be a practical exam, could be a written exam, all right? Either way, you need preparation for it. It is not as difficult as ACJ or NDEC, but still you are gonna have to prepare because it's very competitive. They have very limited seats available each time, and they will just choose the best of the best. So you cannot take any chances. You cannot take any risks here. You have to be prepared. You have to be prepared in a way that they want you to. All right. So bench test and interview. So you have applied, they invite you, you go through bench test, you get accepted for the bench test, you pass it. You will go through interview. If you're good, if you ace it, you'll get in. Congratulations, welcome. The duration of each of these programs is around 2 to 3 years. Some of them are 2 years, which is McGill in Saskatchewan. University of Toronto is 2.5 years, and the rest are 3 years. Okay, so you go and study. It's like you're back in dental school again, right? And this way you will get a DDS degree. You will be a graduate of an accredited program. Okay, so you will have your DDS degree. All right. That's for the 5 schools. For University of Western Ontario, after you take your AFK, you can directly apply for it. They will have a mandatory preparation course, which is called PLA. You have to take it. It's a course. It's like a practical kind of course. They will teach you how to they will go through, I think it's class 1 and everything. Very simple, but this course is mandatory. You have to take it. At the end of this course, they will give you an exam, which is a practical exam again called PLA, which you have to pass it again. And to pass that, their course is not enough because technically that's not it's very superficial. It's not very comprehensive, the course that they offer you. All right. So it's important to be prepared for that one in a proper way as well. All right. So that's only for Western Ontario PLA. And then if you pass that, you will go through the exams, go through interview. Still, there is no guarantee that you get in. All right. So please keep this in mind. That is very competitive. This whole university pathway thing is very, very, very competitive. You have to be very good. They will only get in the best of the best. So the more well prepared you are, the higher your chances. So again, you're spending all this money. I will talk about all of the costs in another slide. You'll be spending all this money. You'll be spending all this time, effort, energy. It's better to be sure. All right. So, yeah, so that's for Western. And then we have Dalhousie and the Dalhousie school, which again, they will ask for a bench test and interview. All right. So that is the university pathway in a glance. And any of these 2 pathways that you choose, either you want to go through direct licensing or you want to go through the university pathway, when you finish them, you will have to go through an exam which is called OSCE. It's virtual OSCE. All right. So even those people who are like Canadians and they grew up here and they just studied dentistry from scratch here in Canada, they have to take that exam as well. Everyone should. All right. The passing rate for that exam is very high. So that is not really an exam that usually we're worried about. It is not an easy exam, don't get me wrong. It is still a very difficult exam which you need to prepare for. But let's say that you have gone through all of these steps. So you're very well blended into the game. So that shouldn't be a problem for you. All right. This is the equivalency. This is for general dentistry thing. This is for general dentistry equivalency thing. You do all these, you will be able to practice as a general dentist here in Canada. All right. There are some other stuff that you can do, which is not very much spoken about. I'm just going to go briefly over them. You can apply for master's degrees or you can apply for specialty programs in some of schools without having the NDEB certificate. All right. I believe that UBC is your option to go to. They do have their conditions. You have to like have a high GPA and everything. You have to have a good resume to be able to get in, but you don't need an NDEB license, NDEB certificate for it. All right. So it's better to do that. You can apply whenever, but it's better to do that after AFK, after you've done your AFK and ACJ. Why? Because it will build up your resume. Because at the end of the day, they are all asking for some local experience. The better, the better. The more, the better. Like I've taken this exam. I've done this. I have done this research. I've done that. The more, the fuller your resume is, the higher your chances of getting an admission. Because a specialty in general here in Canada is not very, it's not very popular, it's not very demanding. So most people are just stay general dentists unless they're really passionate about that specialty thing. So, and if you take a look, not every school even have the program. So it's like U of T, UBC, and the University of Alberta, just only a few. The only school that has all of the specialties is the University of Toronto, which you need an NDEB certificate and to be able to apply. But for UBC, you don't need that. All right. So you can apply. I'm talking about clinical specialty programs, which you need, which UBCs accept general dentists from other countries. Okay. So if you take your AFK and ACJ and then apply, it will be giving you a very good resume. So that is very much recommended. There's some master's degrees, PhD degrees, which you don't even, they're not clinical. They're like mostly like academic based, research based and everything. So you can also go for them. So those are also some options that you can pursue. That's something that some people do. I actually know people that have gotten in for specialty, for special, even clinical specialty thing without going through the NDEB equivalency. That's an option, but again, it's very competitive, very, very limited seatings. But still, if you were into it, it's why not give it a shot, right? So that's the whole idea. That is the general idea. You either go to school or you go through the direct licensing. At the end of the day, you just please do not forget this, that you will need, even if you go through the direct licensing thing, you will need a license from the province that's you want to work in and like live in. Each province have their own conditions again, but the main thing that they need is the NDEB certificate. Like I know that in Ontario, you need an IELTS of 7.5 to be able to apply for that license. But I was not able to find anything for any other province. But if you have that NDEB license, every NDEB certificate, you are able to apply for that license for any province. That is not a problem. Okay, and they will give you your license as long as you are allowed to work in Canada. All right, so you need to have that. That is a different thing. That is a whole different thing. All right, so you should be allowed to work in Canada. So you're either a citizen, you're either on a work permit or whatever. You have to have that legal permission. Okay, you have this. You're allowed to work in any province that you want. You just need to get that license. All right, and if you want to move between the provinces, you can just transfer your license. Yeah, so that's it. That's pretty much it about the exams and the whole pathway, general pathway, specialty pathway. Some people are very eager to be specialists. The best way to become a specialist, like to just have the highest chance to become a specialist, here is to go through the university pathway, the degree completion program, or the advanced standing here, this one's. Get your DDS or DMD from one accredited university here in Canada, and then apply for the specialties right away after. So some of them need residency, like I know that for oral and maxillofacial surgery, you will need residency and everything. But again, that's something to pursue only if you're really passionate about. All right, but if you want to become a specialist, that is the best chance that you have. That is the best way to seek it. All right, so yeah, so that's pretty much it. what I said is that the most important thing to consider is that you have to be very, very well prepared for this whole thing. Every single of these steps, you have to be very well prepared. And to be very well prepared, you need to know the rules to this game. Okay, so it's one thing is the knowledge, one thing is to know how to get that knowledge. All right. And then it's just how you manage your own emotions and stress and everything. All right. What are we doing to help you is that we are offering you courses, which all have been shown to be very successful over the past 10 years, even more than 10 years, I believe. I am going to talk about the courses now, if my computer cooperates with me, hopefully. So let's talk about the courses. Over the past 10 years and more, ConfiDentist has been offering courses and has been expanding too. So here's an outline, a general idea over what we have. As you can see, we are offering courses for each and every single of these steps. And you will have full support, best materials that you can imagine. And yeah, so I'm gonna go in details for AFK course, and I'm gonna go just tell you a little bit about our other course. So our AFK courses, like you're gonna have some options you can choose from when it comes to AFK. And we have the comprehensive course, we have the pre-recorded course, we have self-study materials, and we have the mocks only. Okay, I will talk about all of these in detail, right? So the AFK course is completely online at this point. So it doesn't matter where you are. If you can manage your time difference, you'll be able to join, right? So then after that, for ACJ course, we have the extended course and the regular course. The extended course goes like it happens in a extended duration, and the regular course is smaller. It's kind of a crash course, which starts in the middle of the regular extended course, which is something that is going on now. We have the ADAC course, which is again online. It has everything you need. I will talk about all of these in details. You will have booklets in the courses, you will have lectures, you will have mock exams, you will have question and answer sessions. We have a PLA course, which I'm very happy to say that it has always had 100% success rate. It's on site because it's a practical thing, so you have to be here in Toronto at our center. And then we will have the NDEC clinical skills course, which is again on site. You will have you can customize it based on your needs in the living situation. You can come for 1 month, 2 months, 3 months, 4 months, 6 months, however, how much that you need, as much as you need. Okay, then we have the situational judgment course, which is a hybrid course. It's online and on-site both, because for the mock exams, we're going to have to come in here. And then we're going to have the OSCE courses at the end, hopefully soon for all of you, which again is online. And again, for the interviews, guys, something that people usually miss is that they think interview is not as important, but technically it's the most important thing when it comes to universities. All right, so please do not underestimate that. So, and for interviews, again, we are having courses here, which you will be prepared. You will be taught what they want from you in the interview and how to prepare for them. So please just take it very seriously. All right. So let's talk a little bit about AFK. Sorry. So I told you that AFK is conducted twice a year, once in August and once in February. All right. So we have February 3rd for 2024 and August 13th. So it's important to know these dates. It's important to know these dates because you want to know when to apply, when to register. You have to plan ahead for your NDEB profile application. If you don't have an application, you should start applying for it, and then you should start gathering your documents. While you're doing that, please start your preparation, because let's say that you decide to go for February exam and you will start your preparation, like you will send your documents and everything, you will start your preparation, and then you're not able, like you won't get your approval in time. You won't get your approval in time. So what happens is you're already prepared. So you can just take the whole thing again. You can just continue your preparation, and you will have access to the courses material until August exams. All right. So just mark your calendars. Please set a reminder. It's very important, especially for the registration openings and registrations deadlines. So we have two different things here. We have, again, it's not working. Come on. So for registration deadline, we have January 3rd for February exam and July 9th for August exam. So these deadlines have been pushed back. Before, the deadlines used to be in November. So if you talk to people and they tell you we're not able to register because we weren't approved in time, or everything was full, every seat was full and everything, those are all true because of several reasons. Because before, the deadlines were like very close. Like they were like the registration, the opening date would be like in September and the deadline would be November. Right now, it's not like that. Okay. And another thing is that, yes, when the registration is open, they would get filled, like all of the spots will get filled pretty fast. But until that registration deadline, a lot of people will withdraw. So if you were not able to register, please do not stop studying. There's a very good chance that you are able to register later, okay, until the deadline. It's like technically 1 month before the exam. Okay, so that's, you really literally have a very good chance. All right, so please know all about these dates. It's very important. And then we will have the courses dates, which we will have courses for each of these exams. Comprehensive course for each of these exams. The next course is gonna start in September 15. I'm gonna talk about the course in detail in the coming in the coming slide. So September 15th, we're going to have our comprehensive course. Let's say that you decide, again, I'm going to repeat myself. You decide to go for February exam. You take the comprehensive course. You're not able to take the exam in February, or you do take it and you do not pass, God forbid. You are able to repeat the course. Okay, I'll talk about it. So please mark your calendar, seriously, literally mark your calendars. Okay. So let's talk about the AFK course. So we are offering, as I said, we're offering different kind of courses. You will have options to choose from. My recommendation is always comprehensive course. I will tell you why. So we have comprehensive course, we have pre-recorded course, and we have recorded, which are the self-study material. So for the comprehensive course, what we are offering are a combination of live lectures and pre-recorded lectures. All right. So you will come to class, the lectures are live, and then you will have access to the pre-recorded lectures as well. Some of these lectures are already pre-recorded. Okay. These lectures are one of your study materials. All right. So they are important. So you should be there. You should study these lectures. Okay. So it's very important. So in the comprehensive one, you'll have the lectures, which are a combination of live and pre-recorded. We have 11 booklets, which altogether they cover 13 topics of dentistry. These booklets are very high quality, constantly getting updated. And honestly, you cannot top these booklets. And in the meantime, throughout the course, you will have quizzes. We will have an in-class live quizzes that you will be able to test yourself and practice some kind of questions. This quiz is like, and you're gonna have a very, very comprehensive question bank, which is new, which is all exclusively designed here at ConfiDentist, and they are going to be very, very helpful, okay, in terms of like knowing, like practicing your testing skills, like test taking skills and everything. So it's very, very important to have like these to take these questions very seriously, all right? Then you have the mock exams, which are very also important. So the mock exams will, like, if your preparation here, like let's say that you have taken all the courses, taken all of the course and studied very well, and your preparation is here, the mock exams will bring you up to here. All right. So again, mock exams are very important. We are offering 4 mock exams. Mock exams are usually conducted a month and a half before the actual AFK exam. So let's say when you're taking AFK in February, starting in late December, mock exams will start. And then it's like you're going to have 1 mock each week, which each of them comes with 1 or 2 discussion sessions, which they discuss the questions in the mock exams. There are very good review right before your AFK. So let's say you have AFK today. For the past month, you've been taking other AFKs, okay, before the real deal. All right. So they will warm you up for the thing. You will not be having any surprises when you get to the exam. And everything technically will be reviewed. And at the end of the day, they will give you a very good idea of where you stand in regards with your preparation level. Another thing that we have Q&A sessions throughout the because some of the lectures are pre-recorded. We have Q&A sessions. You will be able to ask your questions live with one of the instructors, and you will have private mentorship. You will have a support system throughout your preparation. Someone will be there, a mentor will be there, which help you with your scheduling, with your emotional breakdowns, with your studies, with your questions, with whatever that you might need for, okay? So this mentorship is going to be your support system. You will have, like, I am working on it. We're gonna have a lot of other amazing news soon. Like we're gonna have study groups, support groups, flashcards, and everything. So this mentorship is also something that will be there for you. So you will never be alone throughout this process until you pass your exam, okay? So that's the comprehensive course. I recommend this course, honestly, for everyone. My experience shows being in the environment of studying, having to be present in class at some certain time, being able to interact with the instructors and other students for that matter is a lot. It will give you some kind of discipline, which will push you forward. It will motivate you. All right. So that is my recommendation. All right. So we also have the pre-recorded course, which is completely pre-recorded. This course is good for those people who cannot manage to appear for the live lectures. They are updated. The booklets are the same. You will have 1 mock exam included, but as I will explain later, you are able to register for the rest of the mock exams separately. And again, it comes with the private mentorship, which I myself am going to be there with you as your support system. So this is a pre-recorded course. Again, it's still a good course. I would say it could work as a supplement for the most part, but still you can make it through. All right. So, and then we have a la carte, which is the self-study booklets, which are honestly, like, I am not a very big fan of studying on your own because of all the reasons that I just said. Again, but you can have access to the booklets, just study on your own. But since like everything is, I always tell people this, that all of the study material that the course is giving you, all of them complete each other. All right. You cannot just focus on booklets. You cannot just focus on mocks. You can just focus on like questions. All right. All of them together combined makes up the material that you have. All right. So that's why I'm not a big fan of self-study. But again, some people want to study before they get into the course. But again, since you can repeat the course, that should not be a problem for you. And we have the mock exams. As I said, we have 4 mocks before each of the AFK course. Before each of the AFK exam. Each mock exam comes with the 2 discussion sessions. Even if you do not apply for any of the courses, you can take the mock exams only, which again, I do not recommend it. I think the comprehensive course is the to-go-to course if you are eager to pass this exam. All right. So that's the whole thing about the courses. And is it enough? Yes, it's enough. So if I want to break this down, so for AFK, because there are like a very, very vast information and resources out there, if you even go to the NDEB's website and see the reference list, it's like they're introducing like 300 references. All right. It's nearly impossible to go. It's not nearly impossible. It's completely impossible to go through all of them. So the best way, as I said, you have to know the rules to the game. The course has given this to you. It will give you the material that you need. It will put you in the right path. It will give you the support system that you need. It will give you the questions that you need. I mean, like for practice and everything. And it's you that you have to do it at the end of the day. But you will have the support that you already need. I always say this, there is no shortcut for AFK because it's a difficult exam. You're gonna have to study a lot for it, okay? But with the right material, the right guidance, and your own effort, your proper amount of effort, you will be able to crack it. All right. So our team here is going to be there with you throughout your course, which our team is led by Dr. Mehdi, which is our head instructor and founder of the ConfiDentist. Myself, as the mentor throughout the course, I'm going to be with you until you pass your exam. We have Dr. Sina, which is now a student, like as a advanced standing at U of T. He also got into some other universities when he was doing his equivalency process himself. We have Dr. Fatima, which is a licensed dentist now practicing, and she's also a professor at U of T as well, and Dr. Peru, which is also a licensed dentist here. So all of us together are going to be there throughout the course to give you the support that you need and everything else that you might need for passing your exam. All right, so we have this, and this is very important. So this is something that I actually hear a lot, is that, all right, so we only have 40% chance of passing because of that historical pass rate that we see on the NDEB's website. Okay, that is not true. That is true. It's not, I'm not saying they're lying. But the thing is, what people do not consider is that they have 3 attempts. So let's say that 100 people, start and go and take the AFK. Passing rate is usually around 40%. In attempt 1, in the first attempt, 40 out of those 100 people will pass, okay? 60 people go for second attempt. Second attempt, the statistics shows that half of those people in second attempt, again, will pass. So out of those 60 people, half of them will pass, so 30. So 30 people will pass. We still have 30 people that have not passed from here, from the beginning. They will go for third attempt. Out of these 30, again, half of them will pass. So in the end, you will have 85% chance of getting through, right? So there you go, 85%. So that's one thing. The other thing is that, okay, so if you're eager to pass it in your first attempt, I always say that, okay, so why do you compare yourself with the people that are not passing? Okay, you should try your best, and you can, with the right material that I said, you should try your best to just be among those 40%. If not, again, you have another chance, and you have another chance. And at the end, 85% chance of passing. That's very high chance. All right. And then the same goes for ACJ, because then again, out of these 185, they will go to ACJ. So you will have less competition. Okay. So this is very important, guys. All right. Right mentality, right mindset. If you want to step foot in this process with the mindset that you are not allowed, you're not able to do it, others are better, what if this, what if that, that's not going to work. You're going to have to be consistent. You're going to have to be disciplined. You're going to have a very, you're going to have to commit, and you have to put a lot of effort. Yes, those are all true. But it's possible. It's 85% possible. So why not? Okay, so please just don't forget about that. Forget about that idea that it's hard. It's not no one. That person said this person said that is doing this is doing that. No, no, no. Just focus on what you have in front of you now and you can control, and you will get through. Seriously. Okay, so in order to help you guys with the costs and everything, so we are offering some payment plans, which Amir is going to talk about in detail. So any of the courses, like if you want to go for the course, like let's say that if you want to take the course for February exam, you can break it down into break the payment into 5 months. And, or if you want to go for August exam, you can break it down into 11 months. And this, again, he's going to talk about it in details. And we are offering you payment plans to help you have a smoother, easier pathway in front of you. And another thing is that, again, if you take the course now, if you don't want to go for the exam in Feb, or if you do and fail, you can you can repeat the whole thing once, okay, free of cost. So you will have one free repeat. Another thing that we're offering is the free trial. So before you apply for our courses, you will get a taste of what the course is offering. So we will give you a sample and you will be able to try it with no obligation. You can choose for yourself, because we believe that we're giving out the best material and the guide that's out there. So you will have the chance to try it for free and see for yourself that it's top notch. So let's talk briefly about the work-life balance. So in the meantime, this is a question that I get a lot. And I will talk about the costs as well. So in the meantime, you might want to work, all right? So what you can do, your options in the working industry. So my opinion is that if you don't have to, don't. Because again, we're giving you a payment plan and everything. So it's a better idea to be 100% focused on this process. But some people can't do that, and some people don't want to do that, because like it's also good for your mental health or whatever. You are going to have some options. The first thing is non-dental job, retail, whatever that is out there, freelance or whatever that you're good at. That's a non-dental job. The other one is dental assisting, which again has different options. You can be level 1 or level 2. Level 1 is chairside. It's just that you are there helping dentists. That's it. If you get a HARP certificate, and this level 1 thing, it doesn't have any cost for you. Just apply and you will get a job. If you get a HARP certificate, you will be able to take x-rays, all right? So you will have to pay for the course for that HARP certificate. You can be level 2, which you need to have the certificate. You have to take some exams at NDEB, all right? Then you will be able to do some intraoral works like impression taking and some polishing or something like that, which it needs, as I said, it needs a diploma. It needs a college diploma. So you're gonna have to at least, I think it's around 1 to 2 years to, if you want to go to college. But for dentists, you're allowed to take the exams directly, which is around like 10K you're gonna have to spend for it. It's 2 exams, all right? You can be a dental office administrator, which again, you can go to college for it and get a degree. So that way you will have to pay like around 4 to 10K for the college, or you cannot do that and just apply and learn the job on the way that you go. The other thing is that you can become a hygienist. But the thing about that, becoming a hygienist, you cannot do it directly. You cannot go and take the exam directly like dental assisting. You have to go to college for it, okay? They might accept some of your credits from your dental school, but you will have to go to college for it. And going to college, and it's not easy. Like you're gonna have assignment, you're gonna have exams and everything, and it's around 2 to 3 years. So, and you're gonna have to pay around 50 to 60K for it. It's time consuming. Okay, it's 18 months. So full-time college student, NDEB process doesn't work. So you're gonna have to do this first if you want to do it. Do this first and then go through that and start your NDEB equivalency. All right, you cannot do them all together, or you can have it as your plan B, which is not a good plan, but you can have it as plan B as well. So that's one thing. And you can also go to and work as a dentist and go to work in a lab and everything, dental laboratory and everything. So these are the options that you have when you're doing this. I, again, personally don't think it's a good idea to work full time, at least while you're doing this, especially for AFK and NDEC exam. But again, you're going to have to be able to manage this. So the most important thing is that you should prioritize. If you're doing your NDEB, if that's your priority, most of your time should go through that. This should only be a part of your time. All right. But no, sometimes you're just, people want to live their life and then give NDEB a try too. That's a different story. All right. So let's talk a little bit about finances. So I'm pretty sure that you all have been researching the costs that you might have. So for each of the steps that you will be taking, you will have some costs, which are not very low either. So you will have the application fee, which is 900. You already know that. And it has to be paid very upfront. It has to be very upfront, because if you don't pay the application fee in 4 hours, your application will be terminated. But you can do it again. So whenever you're making your application, just make sure that you can pay it for right there. And you have to pay everything by credit card, by the way. So then you will have for AFK. So for AFK, the exam itself is $1,000 right now. They're a little bit fluctuating, but like it's usually around 1,000. It could be like 1,000, like it should be 1,100, it should be 900, it could be 900. So it might change a little bit, but usually it's around 1,000. So for AFK, as I said, and I again insist on it, do yourself a favor, take a course, take the comprehensive course for that matter. It should be around 4,000 to 5,000 for the courses and everything. The same goes for ADAT. The fee for the exam is 500. If you want to take the courses around like up to 2,500, you have to pay for it. Then you will have the PLA, which is for Western Ontario again. The course, as I said, the mandatory course that they have is $10,000, around $10,000. And the exam itself is 800. The exam itself is 800. And then if you wanna apply for a course again, that you have to pay around like same thing for the course. At the end of the day, around 25,000 you should pay for the PLA and university pathway in general, because then you will have the administration fee and the exam fee and everything. So then we have the ACJ, which again has the exam itself is like around 1,300. We have the course, which again, please don't do it on your own. Take a course, get help, get support. It's for your own good. And then it's like 5,000 for that. NDEC is different depending on what kind of course you want, how much time you need, because it's different for everyone. Some people like can do it in 3 months, which is not very realistic, but some people need more time. Let's put it that way. Some people need more time. And then the actual real expense that you have would be the equipment that you need to buy for practice. Okay, so as I said, for the exam itself, they will give you the equipment, but for practicing, you will need equipment. You have to buy them yourself. When you apply for a course, they will give you the Darwin's head, they will give you the unit that you need and everything. But for like your composite, your amalgam, your handpiece, your probe, whatever, you're gonna have to buy that yourself. And my recommendation is to buy the exact same things that the NDEB is going to give you. Okay, because you want to master those materials. That's it. Okay, so and then it comes to ASCII, which is like around 3,500. At the end, if you want to be realistic, you need around 80,000 at least for this process. Okay, if you want to go to school, you will have the banks and everything to cover you, like they will give you lines. But at the end, for direct licensing and just applying for school, you will need around 80 to 100K. Okay. How you can pay for it? If you have any income, you can use it. If you have any saving, you can use it. There are aids out there. There are institutions, organizations out there that are willing to help you. We have the guests here, they will talk about it. We have Windmill organization, which if you directly apply for Windmill, they will give you up to 15K. There is a program which is Windmill and CIBC together, 25K. We have the CIBC loan, which is 125,000, up to 125,000. Again, they will be talking about it. And we have the institutional payment plan, which is the exciting part here, which Amir is going to cover pretty soon. The ConfiCare plan, which we've just launched, and you will have payment plans which help you pay interest-free for your courses. Okay, so I am going to hand the mic to Amir now. Hopefully I'll be able to answer your questions at the end of this session. But if you have any questions left, you can get my email address from the office, or you can book a meeting, one-on-one meeting with myself, and I will be answering any questions that you might have. And it's going to be free. And so, yeah, just feel free to reach out to the office. You can just call the office, ask for me, ask for my email address, and just contact me, and I will be there for you to answer any other question that you might have left. And yeah, it was a pleasure talking to you guys. Okay, so I'm going to say goodbye. I might come back, but Amir, you go now.
All right, thank you, Dela. Thank you so much. And how's everybody doing? So is that informative? Thumbs up or any reacts in the chat? Yeah. Oh, thank you. Okay. I'm just gonna go as quick as possible to cover the rest. Sorry for my background noise. For those who are in Toronto, they know there are lots of aircrafts and like flying things on there for exhibition. So anyways, now I'm gonna invite Simon from CIBC to talk more about the finance and the opportunities out there that they support the dentistry students. Unfortunately, based on some unexpected incidents, we cannot have Sachin, but Simon gonna kindly cover the information about like how CIBC and Windmill collaborate. And Simon, are you in the call? So just I'm trying to find Simon. Yes, if you can turn on your camera, we can have you. So while Simon is getting ready, I just wanted to say thank you for all of you to be in this call. That was so being a big pleasure for me to be in this session and exchanging those information about like the pathways and the dentistry journey is always exciting news based on the demand and the needs. Okay, Simon, we are waiting for you. I see you're in the call. I'm just waiting for you to turn on your camera and we can start. Okay, oops. Okay, till Simon get ready, I can start talk about our ConfiCare. Okay, Dela, can you share the screen? Like I can have access to the slides, and then I'm gonna continue with the slides. Okay. And the control stop. So can we go to the next one? Yep. One more. Okay. ConfiCare, as we have always considering the making a better and smoother journey for our members and our community. So we run the ConfiCare campaign to support mostly financially our dear students. So we have for a couple courses such as AFK and okay, Dela, can you hear me? So
Yeah,
help me out for going through the slides. So for AFK, ACJ, and also the pre-recorded stuff, Dela, if you can just press on the slide to go forward. Because yes. AFK plus ACJ. So for the AFK pre-recorded and ACJ pre-recorded, we're gonna have the same ConfiCare platform, and if we go forward, we're gonna have ACJ only course that we're gonna run the ConfiCare program, and for the next courses like PLA and NDCC. So if you are like aiming to get any of those courses to prepare for the exam, ConfiCare has lots of good news for you. But before I continue, because we have Simon on the call, so I'm just gonna pass the conversation to Simon to talk about CIBC offers for you, dear members, and then we're gonna continue about the ConfiCare.